much do you really know about drug and alcohol use during pregnancy? I personally did not know a lot until I did a little research, and what I found out was very alarming. WebMD states that drug and alcohol use during pregnancy can cause miscarriage and mental, physical, and emotional problems with your child. These problems can range from mild to very severe, depending on how much alcohol or drugs that your child was exposed to. WebMD also states that fetal alcohol syndrome is a combination of physical and mental birth problems with your child. 1 in every 1,000 babies born is born with fetal alcohol syndrome. Babies born with fetal alcohol syndrome may have small size and low birth weight, small heads and facial and head deformities, defects of the joints, arms, or limbs, poor muscle coordination, heart defects, and even intellectual disabilities. Children with fetal alcohol syndrome may continue to have behavioral and learning difficulties into their adulthood. Healthline.com states that in general, drugs can cause miscarriage, stillbirth, small size, low birth weight, birth defects, premature birth, and sudden infant death syndrome, and drug dependency in the infant after they are born. Some specific risks of drug use during pregnancy are: low birth weight places the baby at increased risk for illness, mental retardation, learning disability, and long-time consequences. Premature birth increases the risk of lung, eye, and learning problems in the infant. In addition, preterm babies are at increased risk for infection and even death. Fetuses can become dependent on the drug that their mother was exposing them to after they are born and have symptoms after delivery. Drug use early in pregnancy can affect the developing organs and limbs of the fetus. Even one episode of drug use during pregnancy can affect the development of your child. Often the result is a birth defect or miscarriage. Drug use later on in pregnancy can affect the development of your baby's central nervous system. After pregnancy, many drugs can pass through breast milk and can harm your child. According to the Substance Abuse and Mental Health Services Administration's 2013 survey on drug use and health, 5.4% of pregnant women between ages 18 and 44 used alcohol during their first trimester, 4.8% during the second, and 2.4% during their third trimester. Similar numbers were seen with marijuana, cigarette, and binge alcohol use. For all of these reasons that I have recently stated, I strongly believe that drug use and alcohol use during pregnancy should be illegal. How do you feel?